The following is a demonstration of a healthcare provider meeting with a postpartum adult who is not open to quitting tobacco. Notice how the provider works to motivate the patient to consider a quit attempt with the use of the 5 R's: relevance, risk, rewards, roadblocks, and repetition.
I saw on your paperwork that you stopped smoking while you were pregnant and that you started again.
Yes, and I am so upset about it. I was so proud of myself for quitting once I found out I was pregnant. And I don't know. I've been just really stressed and exhausted lately. So I guess I gave in.
Well, I'm really glad you were able to quit while you were pregnant. That was really good for your health and hers. And I hear you're disappointed now. Having a new baby is hard. It's a lot of stress. And it sounds like you went back to something that's helped you manage stress before.
Yes, it's just so much.
Yeah. It is important for you. It was important while you were pregnant to quit. It's important now too, both to keep your baby away from second and third hand smoke and also for your health.
I know.
Yeah. Have you thought about trying to quit again?
I know the answer should be yes, but no. I just don't think I can right now.
When a patient is not ready to quit, you can continue tobacco cessation counseling by using the 5 R's. Notice how the provider employs motivational interviewing techniques to help the patient move towards readiness to quit.
Yeah. It sounds like maybe a little bit too much on you right now.
Yeah, I think adding that in would be too much for my mix.
Yeah. What are some of the obstacles? Like what's sort of keeping you from wanting to quit?
Well, I just don't think I have the time to focus on quitting. I'm spending so much time focusing on my baby, like feeding her, changing her diaper, doing laundry, just everything. And also, originally, when I was pregnant, everyone was super supportive. They stopped smoking around me, they encouraged me to quit. And now that the baby's here, everyone's gone back to smoking around me again. And it's like they don't care that I'm smoking again.
Yeah. Yeah, you have so much less time because you're taking up care of a whole new person. And the people around you have gone back to smoking around you where they were trying to stay away while you were pregnant. I'm sorry to hear that. That sounds like it's been a really stressful time lately. What motivated you while you were pregnant?
Ugh, the smell.
Oh, yeah.
Yeah, the smell absolutely made me sick, but it doesn't bother me as much now.
Mm-hmm.
I also decided to stop smoking because it was good for her health.
Oh.
And I mean, it doesn't seem as bad to smoke around her. Like, I know she's exposed if I smoke now, but it just doesn't seem as bad as when I was pregnant because she's not inside of me anymore, you know?
Yeah, so I hear that from a lot of people that the smell makes you sick. So it's a little easier to quit. But also that when she's inside of you, yeah, her health is so dependent on your health. It was a little more motivating. And when she can you can maybe put her in another room or be outside away from her. Yeah. Well, secondhand smoke does have some risks for your baby and thirdhand smoke too. Secondhand smoke can make it more likely that she have asthma or ear infections or some breathing or called respiratory problems. So there are some risks. So we want to ask that you do your best to smoke away from her. Third-hand smoke, those are the particles from smoking. You can't see them, but they land on your clothes and in your hair. So you might want to change your shirt after you've smoked and make sure you wash your hands. And, the other thing I'll say is I'm here whenever you want to talk about cutting back or quitting. If that's something you want to talk about, think about, you don't have to commit to anything. We can always check in. I do have a booklet for you. This is for people who have gone back to smoking after they had a baby. So just some information, some good tips. And I can also connect you with the Quit line. So even if you're not ready to quit smoking, they have free coaches that you can talk to 24/7 by phone or text message. I'll give you their information just to think about if you want to reach out to them.
Okay. I'll try that, and hopefully next time we meet, I'll be ready.
Okay, that sounds great.
Visit YouQuitTwoQuit.org for free resources for your practice, including training on evidence-based tobacco use screening and cessation counseling, technical assistance for implementing the 5 A's and 5 R's in your setting, as well as educational materials for healthcare and allied health professionals and patients. That's YouQuitTwoQuit.org.